A very warm good evening to one and all. Welcome back to the today's session. Today our guest speaker name is Dr. Bhavna S Patel ma'am, Associate Professor from Homeopathy Pharmacy Department, CN Kotari Homeopathy Medical College and Research Center, Vaira, Gujarat. We welcome you ma'am. We welcome you all the participants. Today topic is regarding ideal potency for genital cure. We welcome you, ma'am. We welcome all the participants. The session is all yours, ma'am. Thank you.
Thank you. Uh, Bhavna, please, I'm not getting PPT properly.
Pardon, ma'am.
I'm not visualize this. Okay, get it. Okay,
Got it?
shall I start my session?
Yes, ma'am. Session is all yours, ma'am. Yes, ma'am.
Okay. First of all, I would like to thank all the post holders of this All India Homeopathic Students and Youth Association to offer me this platform to convey the fair fact of homeopathy. And one more thing, I would like to wish all the male doctors uh, happy Men's Day. Just few days before we observe the International Men's Day on 19th of November. Now, my motto to select this topic just to aware you people to the scale which is helpful in some failure cases, where especially when you feel your selected minimum is perfect, but you are not getting that desired result, not getting proper care. So for that, actually, I have not much experience about this potency. I given in few patients, but it's my favorite topic as I am teacher of homeopathic pharmacy. So just my motto to highlight this faded fact of the homeopathy. So this is the ideal potency for gentle cure. So please next slide. Lavanya, can you hear me? You
Yes, ma'am. Is it visible to you, ma'am? The second slide. Hello, ma'am. Am I audible to you, ma'am? Hello.
next slide. Lavanya, please next slide.
Yes, ma'am. Here it is, ma'am. Hello, ma'am.
In nervous excitability. So for that, even after using the 30 centesimal dilution, he observed that he was facing unnecessary aggravation is getting because of centesimal scale only in some cases. So please I am talking about only some cases, not about all the cases. Okay, next slide, please. This thing lead him to process of further minimizing the material quantity of drugs and augment succussion. We are preferring 10 succussion, 10 strokes. So he decided to use the 100 succussion for each potency preparation. And this principle was introduced in the Organon of Medicine, 6th edition in aphorism number 70. Next slide, please. This potency by 15 millisievert. Your server is working low, Lavanya.
Ma'am, actually, we are unable to listen you properly, ma'am.
Okay, wait. Are you listening properly? I am audible. Audible. Lavanya, I am audible.
Hello, ma'am.
Hello. I'm audible, Lavanya. Now I am
I am
audible.
audible.
Yes, ma'am, you are audible. Kindly proceed the session, ma'am.
I am
I am
audible.
audible.
Yes, ma'am, you are audible.
Hello, ma'am. Am I audible, ma'am?
Am I audible now?
Hello, ma'am.
Hello, ma'am.
Just
Just
give me
give
few
me a few
minutes.
minutes.
Yes, ma'am.
Now I am
I am
audible.
audible.
Hello.
Yes, ma'am. You are audible now, ma'am.
हेलो लावण्य मैम।
Yes,
हेलो
sir.
मैम, मेरे को लगता है मैम ने 2 लिंक से ज्वाइन किया हुआ है।
Sir?
मैम ने डॉक्टर भावना मैम ने दो डबल लिंक से ज्वाइन किया हुआ है, क्योंकि आवाज गूंज आ रही है, डबल डबल साउंड आ रही है।
हाँ जी सर, मैम लैपटॉप से भी ज्वाइन हो चुकी है एंड मोबाइल से भी
Now
ज्वाइन हुआ है
Lavanya, I
सर।
am
I am
audible.
audible.
हाँ, तो वही तो इशू आ रहा है ना
Hello.
कि मैम की आवाज साउंड मतलब रिपीट हो रही है, तो या तो लैपटॉप की मतलब लैपटॉप से बंद करते हैं वो स्क्रीन लाइट में चला दूंगा।
ओके सर, मैं बोल दूंगी सर मैडम को। मैम, एम आई ऑडिबल टू यू मैम?
Hello.
हेलो मैम, एम आई ऑडिबल
Yes.
टू यू मैम?
I hope I am audible properly.
Ma'am, actually, can you kindly log in only from one either laptop or from mobile, ma'am?
Yes, yes, got it. Let me end session from my mobile.
Yes, ma'am. Kindly you can have the session from the mobile, ma'am.
Okay. Now I am audible.
And yes, ma'am. Absolutely, ma'am.
Okay. Now shall I continue from that last slide?
Yes, ma'am. Continue from the last slide, ma'am.
Okay.
Yes, ma'am. Session is yours, ma'am. Yes, ma'am.
Okay, just now we are talking about this renewed dynamization. It was mentioned in section 132 in foot number 1. That is, he mentioned new altered but perfect method. And we all, everyone know about this method, and we are knowing this method by 50 millisiemel scale or LM scale. So please next slide. Next slide, please. Next slide, please. Okay, perfect. Now, for this, please go back. Please go back. Please go back. Just one slide back. Please one slide back. Goes to one slide back. Okay, perfect. Now, for introducing this scale, had a lots of hurdles journey. Okay, first of all, first hurdle is the German publisher's carelessness. Second one is the in 1843 we lost our hero. So this is the second big hurdle to lighten up this potency and to lighten up the sixth edition. And last one and third one is the too big, and that is because of second wife, Madam Malani. Next slide, please. So first we will talk on the first hurdle. In 1842, Dr. Hahnemann completed sixth edition. It was 19-month labor work. He prepared in two versions, German and French. Among that, he wanted to publish first French version, then German. But it was unpublished because of German publisher carelessness. It was hurdle in presence of our master. Okay, when at that time Dr. Hahnemann was live, in 1843 we lost our hero. That is the second hurdle. Okay, please next slide. And third hurdle is the Madam Malani. But after the death of Dr. Hahnemann, his manuscript was in his second wife custody, and she did not allow the publication of sixth edition because of her unexpected greed for money. From all over world, some homeopaths tried to obtain the sixth edition, those in German and French version, but there is not getting success. At that time, Dr. Boning Hussein, Dr. Herring, Dr. Dunham, Dr. Dice, even Sus Hahnemann also tried, the grandson of Dr. Hahnemann, but all was failed. Next slide. At last, there is the some lighten up. In 1878, Melanie died after long in 1920s. See the gap between 1878 but we get the chance to publish this hidden secret in 1920, and it was done by R. Hell, but it was in German version. Now, in 1921, William Borick published perfect retranslation of sixth edition of Organon of Medicine from original German text, but nobody gives any importance to this new dynamization method because of fully establishment of centesimal potency in the homeopathic world, because this sixth edition is only written by him but not published. So until that, everyone is habituated, everyone is settled with this centesimal potency, even they are facing the problem. Next slide please. Now there is the, unfortunately, the homeopath's attention is driven up, and it was done by Charles Pound and Dr. Pierre. He is from Geneva and Charles from France. In 1950, this both homeopathists tried to publish his experience about this 50 millisiemens scale. Among that, in 1950, Charles published his article, My Experience about Hahnemann's 50 millisiemens scale potency, in the British Homeopathic Journal. Next slide. In 1954, since the publication of French translation of this sixth edition of Organon by Dr. Pierre and his article in British Homeopathic Journal, headed by the hidden treasure of the last Organon. And this heading drawn the attention of homeopaths for these changes, and everyone is eager to know about these changes, why, how he arrived these changes. Next slide. Now, Dr. Pierre is given the name to this potency, that is the 50 millisiemens scale. Dr. Hahnemann described this task, altered dynamization. Okay. Now next slide, please. First of all, we will discuss on how and why Dr. Hahnemann arrived at this 50 millisiemens scale. So Dr. Hahnemann wants his pathy work as highest ideal of cure, was rapid, gentle, and permanent, but not it even selecting proper simillimum. He is not getting the result rapidly, gently, and permanent. During his practice life, he was faced various problems practicing with homeomedicines, those prepared under centesimal potency as per the fifth edition of Organon of Medicine. Okay, until this sixth edition, and until after facing this problem, he get idea to change something in potency. So he will get the desired result. Next slide, please. Now, Master Hahnemann was dissatisfied with the centesimal scale because the potencies were not acting rapidly. As he written the law, the homeopathy medicine is act rapidly and gently, but he is not getting success in this rapid action. Second thing is the period of cure took very long time. The time and frequency of remedies were difficult to ascertain correctly. One more thing, in certain weak sensitive constitution with chronic miasmatic diseases, even in lower potencies, were not able to stimulate a healing reaction. At the same time, the higher potencies causes serious aggravation. So he want to decrease between this lower potency and higher potencies ratio. Okay, because he is not getting proper result in lower potency, means there is not at all the procedure is going to stimulate, okay, or curing procedure, and instead of that he's approaching to the higher potency, so he's not getting the proper result. So he want to make a path between these two potencies. Next slide, please. Now, we will see how this new altered but perfect method is growing up. So Hahnemann found in certain cases that the lower potencies were not able to stimulate healing reaction. At the same time, the higher potencies causes serious aggravation. So he wondered if it was possible to make homeopathic remedies that acted deeply, yet at the same time were gentler on the constitution. Next slide, please. For this, his unsatisfactory result of centesimal potency, Dr. Hahnemann decided Dr. Hahnemann decided to do more experiment research through clinical trial and came to minimize the dose with maximum result. Next slide, please. His highest ideal of cure was to cure rapidly, gently, and permanently. Hence, he failed to modify dynamization technique and method of preparation of potencies to achieve his ideal cure. Next slide, please. I am audible.
Yes, ma'am. You are audible, ma'am.
There where he finalized and what to changes. Okay, so first of all, he decided to change in a crude drug substance. Then second thing is the vehicle, means he want to change the drug vehicle ratio, and at last third one is the number of succussion. He decided to give the 100 stroke instead of the 10 strokes. Next slide, please. Okay, so the basis for the modification was that less means he described why he want to decrease the material quantity, because if we decrease the material quantity of the drug, so lesser the chances of medicinal aggravation. Okay, so he find out the solution to decrease the or to avoid the medicinal aggravation. So for that he decided to change into the crude drug substance. Okay. Now, second thing is the he want to make a more strong. So for that, he decided to potentize remedy. The more it acts permanently and rapidly. So he decided to increase the succussion. The more a medicine is diluted, less is its duration of action is milder, and hence repetition could be done without any harm. So because of this drug and vehicle ratio, the substance will be diluted, so easily we can repeat frequently, and it will give the milder action. Next slide, please. So after his long time research, near about he spent 4 to 5 years for discovering new scale for preparation of medicine. Those give rapid gentle cure, and at last he secured success for the introduction of new dynamization method by changing in the drug vehicle ratio and increasing the succussions. Next slide, please. So, new dynamization method. At last, he was satisfied that he had found the perfect method for to fulfill the highest ideal of care, which is rapid, gentle, and permanent restoration of the health. This is the last gift from Dr. Hahnemann to homeopathy and was the outcome of his 50 years of research work. So, it is too valuable for us when we are facing the problem to giving a proper cure. Next slide, please. Now, hence the solution was to widen the gap between the medicinal substance and the diluting medium. Incredible reducing medicinal quantity to prevent any furious potency aggravation. And the motto of 100 suggestion to develop the power of medicine to the desired extent for a most rapid and long lasting penetration. Next slide, please. Now, at last, get satisfactory observation from new scale. Dr. Hahnemann observed the new scale is work rapidly. Medicinal aggravation is easily avoided by decreasing the quantity of dose. Frequently repeat both in acute and chronic cases. Medicine may be continue even after improvement start. Chronic diseases cure in short period. Next. So in this way, Dr. Hahnemann slowly reached to his goal for rapid, gentle, and permanent cure. Next slide, please. Now we will see how this potency is prepared. We are talking about the preparation of LM potencies as per HPA. In HPA volume number 1, there is given the how to prepare the medicine under LM potency, under LM scale. Okay. So for preparation of this potency, we have to prepare in 3 stages. First one is the solid stage. Second one is the liquid, and again this liquid will be into the solid, and that will be the global form. So first of all, we have to triturate the drug until 3C potency. Okay, as we reach to the 3C potency, we have to take the 1 grain of this 3C potency in clean glass vial. Okay, and then you have to take the liquid of 500 drops, but that 500 drops is divided into the 100 drops and 400 drops. So as you take the 1 grain of this 3C trituration of desirable drug, then you have to add the 400 drops of distilled water and then add the 100 drops of alcohol. Okay, as you add this 500 drops of liquid, then you have to just shake it. There is no need to give the any succussions because we are preparing the mother tincture of LM potency. So no need to give the succussions. Okay, so as you dissolve this substance in liquid, then you can label it. You have to label it. This is the mother tincture of LM potency of particular drug. As you prepare this mother tincture potency, then you can move for preparation of 0/1. So for that, you have to take the only single drop of this mother tincture of LM potency in new clean glass vial. Okay, then as you okay, as you take the 1 drop of this mother tincture of LM potency in new clean glass vial, then you have to add the 100 drops of alcohol. As you add the 100 drops of alcohol, now task to give the 100 succussion. Okay, it is little bit laborious work, but we will get the perfect result. Okay, so as you over this 100 succussion, then this will be the 0/1 liquid potency. Okay, after preparation of this 0/1 liquid potency, you have to convert this into, and you have to prepare in globules. So for that we are preferring the poppy seeds globules. Nowadays they are calling 10 number globules. Okay, uh, for this we have to take the 100 poppy seeds globules. The weight is 1 grain, near about 65 gram. Okay, now you have to take the third one, neat clean glass file or bottle, and take 100 poppy seeds globules, and then you have to add, you have to just moisten that globules with the 0 by liquid 1 potency. Okay, as you prepare in globules, then you are eligible to dispense. Okay, you can't dispense directly the liquid potency, liquid form. Okay, you have to dispense this medicine only in globule form. Okay, so as you moisten this globules, then you have to transfer this globules on the filter paper just to dry it to evaporate the extra medicine. Fill after evaporating of, or after drying, you can fill these globules into the bottle and label it. This is the 0/1 potency of particular drug. And without forget, you have to mention their manufacturing date. Okay. For preparation of 0/2 potency, you have to take the single globule. Okay, you have to take the one globule and dissolve into the one drop of distilled water. As it dissolves, then you can add, you have to add the 100 drops of alcohol, and again you have to give the 100 downward stroke, and you will get liquid potency 0/2. By same procedure, you have to convert into the, you have to prepare in globule form, and then you can prepare further potencies, like uh, preparing in liquid potency, then convert into the globule. As you prepare 0/2 in globule form, you can move for 0/3. Okay, so this is how to prepare the LM potency. Okay, now next slide, please. Okay, now this LM potency is designated in India, that is 0/1, 0/2. Even Dr. Hahnemann used to write to denote this potency 0/1, 0/2. Okay, now this scale is denoted in Bangladesh M/1, and in Western world 1/0. Okay, now why we are calling this no calling this potency as a LM potency. So in Roman, 50 denote the L and 1000 denotes by M. So that's why we are nomenclature this scale as a LM scale. Next slide, please. Now we learn how to prepare the potency. Now the main task, preparation of doses for LM potencies. When you are prescribing this medicine, that time how to prepare the dose. So let us see. You have to take the one globule of desired potency and place in a clean bottle. It will be glass bottle is better, with about it is having this 4 to 6 ounces of water. This medicinal solution is now ready for use. So you have to advise the patient before taking the medicine, you have to give the straw. That is the succussion. And it was 8, 10, and 12 times. It depends on the patient condition. In next slide, we will see why, when to give the 8 stroke, when to 10, when to 12. Okay. it is depend on the sensitivity of the patient. This rises slightly the potency and activates the remedy. So that's why before taking the medicine, we have to advise them. Before injection, you have to give the straw. Next, please. Now, how to manage? So, for suckers the bottle just prior to injection, 8, 10, and 12. So, 8 times very sensitive patient, 10 times for less sensitive patient, and 12 times for the least excited and sensitive patient, depending on the sensitivity of the patient, because it is helping to raise potency and activates the remedy. Next, please. Next slide, please. Okay. Now see, take up one. Okay. Perfect. Now take a 1, 2, or 3 tablespoon of medicinal solution and place. Please, we are going on wrong slide. Please go back. Pen full करजो ने. Pen full करजो ने. Please go to the preparation slide. Please go to the back. Now, we are talking about the doses. Okay, each dose from the medicinal solution of each potency is to be applied in the same manner. In case of any aggravation to this dose, further administration is halted and the aggravation allowed to settle down. If the same remedy is indicated, then it is now administered by diluting the medicine in second, third, or fourth glass of distilled water to make the dose as safe and harmless as possible. When you are facing the dose, the complaint is getting aggravated. So at that time, you have to dilute this dose, your prescribed dose, in second, third, or fourth glass. Next slide, please. I think we are missing one more slide. Please go back. Again, you have to go back. Go back. Go back. Please go back to the preparation. Okay, okay, perfect. Now move toward the one side, one slide. Go ahead. Now take 1, 2, or 3 tablespoonful of medicinal solution and place it into the 4 to 6 ounce of water and stir. Okay, when you are prescribing this medicine, so you have to give the one globule, okay, uh, and bottle having the 4 to 6 ounce of water. Okay, then once you have to you have to advise the patient when you are taking the medicine, that time you have to take the 1 tablespoonful, 2 or 3, depends on the patient's complaint, in half cup of water. Okay, then stir the medicine, take a 1 tablespoonful from that half cup of prepared medicine. Okay, and throw away remaining medicine. Every time you have to advise them, you have to prepare the medicine every time. If you are prescribed TDS, so they have to prepare morning time half cup of medicine, afternoon time same manner, evening time same manner. When they take the prescribed tablespoonful of medicine, remaining medicine they have to throw it. For acute and chronic conditions, apply 2 drops directly on the tongue. Suppose in acute and chronic conditions, okay, and it depends on the sensitivity of the patient. You can advise directly to take the 2 drops on the tongue. Directly below the tongue, and in very urgent cases, apply the drops sublingually. Next slide, please. Now, each dose from the medicinal solution of each potency is to be applied in the same manner. Okay. In case of any aggravation to this dose, further administration is halted. Suppose even giving this LM potency, and if facing any aggravation, so there is no need to fear, because as you halt the further dose, aggravation will be relaxed. It will be settled down. If the same remedy is indicated, then it is now administered by diluting the medicine. If you are facing the problem, even selecting the proper simillimum, and also under this LN scale, you are facing the aggravation. That time you have to dilute this desired potency in second, third, or fourth glass of distilled water to make the dose as safe and harmless as possible. Next slide, please. Now, when we can repeat the medicines, okay? So, very urgent cases, take the medicine every hour or more often. In acute illness, the drug is repeated every 2 to 6 hours, and in chronic cases, the drug is repeated daily or on alternate days. Next, please. Now we will see what is the advantages of LM potency. Okay, it becomes easy to select from a limited range of potencies. No fear of aggravation of disease or patient's condition by administering it in high or low potency and in repeated doses. Next, please. It can be repeated anytime when there is need for medicine according to law of similar. Frequent repetition is permissible even for long-lasting correction. Even long-acting medications can be administered safely. Uh, just we heard that rust of sulfur, some medicines are long acting, like lac acid. So, in such a medicines, we can safely administer, we can safely repeat it under LM potency. And the medicinal action by this LM potency is quick and rapid. Accurate judgment of nature of cure also is possible. Next, please. The gentlest of all methods of performing homeopathy with this potency, the ideal of healing can be materialized. We can easily adjust the dose so that the dosage is individual for the patient. This potency is best for the treatment of hypersensitive people, especially in psychological cases. It is also best for the treatment of chronic diseases, severe pathologies, and miasmatic diseases, especially active miasm with discharge and hyperallergic reactions. So, in such cases, we can repeat frequent
Hello.
Hello,
You
I
are,
am audible.
yes, ma'am. Hello.
Please, next slide, please. Next slide, please. Now, medicine with LM potency are milder in reactions. It can be safely administered even in most fatal cases without fear of dangerous and violent medical deterioration. Least amenable to antidotes means there is no need to give the antidotes when you are changing your prescription. This potency gives full freedom to both physician and patient to perform the training of centesimal potency. If the selection is found to be incorrect, a new well-selected drug may be given without the antidote of the previous one. Next slide, please. Now we seen that all the advantages, every coin having two sides. So here is also some disadvantages that is related to the preservation and related to the preparation. Just we seen that it is little laborious work for preparation of LM potency. So first of all, there is some disadvantages related to the preservation. As we see, we have to dispense with distilled water. So LM potencies are always used in liquid form. So there is a chance of spoiling water, which is to carry the medicine. So it should be mixed with rectified spirit for preservation of medicine. Now, container stoppers cork should be of very good quality for long time preservation. The process of dispensing is also time consuming. It can be a problem. Next slide, please. Now, this is LM potency is the newest therapeutic system of the homeopathy. The highest development of power in this new method of dynamization. The material component of the medicinal substance is more reduced, but the grinding, pounding, and succussion are increased many times. Thus, the latent and abiding nature of material substance is fully developed in this way. And Hahnemann says that the highest development of strength and the mildest action. So this is our LM potency. Uh, I am concluding here my session. Just we get the result in 2 to 3 cases. As previously I told, I have not much experience with this potency. My motto is just to highlight the faded fact of the Dr. Hahnemann work. So in my practice, I am not practicing that much. We are just examining few patients, and in that, one of the case that is the 19 years old boy who is the rifle shooter, and he's having problem that is profuse sweating and trembling, and along with that, he's having the hypertension, and his BP was 140 by 100. So when he consulted to me after taking allopathic medicine, that time his BP was 140 by 90 something. So I just give him Raulfia mother tincture. Okay. After 2 to 3 follow-ups by Raulfia mother tincture, he feels better in uh, hypertension. Means a little bit perspiration is decreased and his BP is normal, but the trembling is as it is. So I asked him about his mental stress or any tension, but that boy is very happy-go-lucky, and he's saying that I am excitingly attempting my task when he is performing. So I decided to give him on the basis of his signs and symptoms, Jalsemium 200. Okay, so after giving this Jalsemium 200, he's getting relief. But as he over the medicine, he's getting same complaint, appearing same complaint. So 3 to 4 times I repeated in between 30 and 200. Then I across to this LM potency. So without giving 1 m, I directly go to the 0/1 Jalsemium. And after giving 3 doses, he is feeling better. And last 15 days before, I given him this 0/1 Jalsemium. And now I am waiting to hear from him. Okay, so this is the our session. I'm concluding here. If you have any question related to the preparation, okay, or any other, I have not much experience about the patients. Okay, so please, if you have any query, you can ask me. Dr. Lavanya, I am concluded my topic here. આ 1 કલાકનું જ હોય છે કે? Welcome to any queries. Please, Dr. Shalu, please send me your queries. Dr. Lavanya, I am over here.
Hello, ma'am. Am I audible, ma'am?
Yes,
So sorry, ma'am. Due to my network issue, ma'am, I can't able to hear
it's
you, ma'am.
okay. It's
Yes,
okay.
ma'am.
Uh,
Respected
can I?
participants, can we have the question and answer session? It is open for you all. Um, there is a question, ma'am, from the participants.
Yes. Okay.
Can you tell us the gap between two doses of LM potency in the case you mentioned?
There is I given him alternate day, single dose, and I prescribe only 3 doses, and advise to take alternate days. I am audible.
Yes, ma'am. You are audible, ma'am. Yes, ma'am.
Okay. Anything else?
Yes, ma'am. Ma'am, how frequently we can use the long-acting medicines, ma'am?
See, as I told you, I have no more experience about this potency in patients. I just started few months before, but as I read
Okay.
in some literature, so there is you can prescribe, you can repeat on the basis of the susceptibility of the patients and what is the
Mm-hmm.
complaint. Means nervous excitability, there is the in suppose just I had one more experience in psychological disturbed patient. In
Mm.
that patient we repeated very frequently 2 hours
Oh.
within 2 hours, 2 hours
Mm.
interval, and we given this doses for 3 days. But
Mm.
in one day medication there will be the 50% result, and that patient was too happy with this LM potency.
Okay, ma'am. Okay, ma'am.
Okay. Yes, anything
Uh,
else?
Any other questions from the participants? They are welcome actually. Hope they have the clear vision about the topic, ma'am. So
Okay.
yes, ma'am.
Okay.
Uh, okay, ma'am. Uh, Thank you all. Thank you so much. Thank you, ma'am, for enlightening us with a valuable session.
Okay.
Thank you all, dear participants, for the overwhelming response. And we'll be back with the one more session by tomorrow. And we'll be continuing the series with a